Hi, I'm Elizabeth Croning, licensed clinical social worker at Merit. Merit is the Medical Evaluation Response Initiative team through the University of Illinois College of Medicine, Rockford. Today, I'm excited to share with you the growth and impact of our enhanced services and community prevention education program throughout program year 4. Merit was founded in 2008 to provide medical and forensic exams for children who may have been abused or neglected. We now serve around 400 children each year across 13 northern Illinois counties. In 2024, we expanded by adding a licensed clinical social worker to the team and launching the Enhanced Services and Community Prevention Education program, offering trauma therapy, medical advocacy, and community education. We want to take a moment to sincerely thank the Winnebago County Community Mental Health Board and voters who approved the half-cent sales tax to fund vital mental health services in our community. Your support is essential to making this program and its impact possible. I want to start by looking at our program overview. Our program focuses on 3 key areas: medical case management, trauma-informed care, and community outreach. The services listed here show what this looks like in practice, and we'll be taking a closer look at some of them as we go. Trauma-informed care and medical case management services are available for any child ages 0 to 21 in Winnebago County who's come to Merit for an exam and needs some support. Community education is targeted for any adult in Winnebago County who works with, has, or cares for children. When abuse or neglect is reported, children may be referred to Merit by DCFS, law enforcement, child advocacy centers, or other medical providers. Our team then conducts an initial assessment, screenings, and a medical exam. Children and families in need of additional support are connected to the Enhanced Services program to assess their need for services, including therapy, resources, and advocacy. Sometimes we're able to do a warm handoff the same day, making the first step towards healing easier. Now that we've shared an overview of the program, I'd like to highlight the impact from program year 4. This year, our program served 32 unique children, mostly between the ages of 16 and 17 years old. Our services reached children and families across many zip codes. Rockford zip codes made up the largest share, 42% of all clients served in the program. In program year 4, we provided 224 services, including therapy, team meetings, advocacy, referrals, and consultations, reflecting the wraparound nature of our work. Next, let's see how families rated their experience. Families shared feedback through surveys for both stakeholders and therapy clients. Results show real impact. 67% gained skills and resources. Families rated services nearly 5 out of 5 stars, and 82% of children said therapy helped with their problems. Here are some of the thoughts from the families and children in our program. These words remind us why this work matters. Children feeling heard, parents supported, and families finding hope. This year, we launched our work on adverse childhood experiences, or ACEs, using resources and training from the California ACEs Aware Initiative, the first statewide effort of its kind. Research shows universal ACEs screening leads to more effective and equitable care. At Merit, this approach helps us better educate and support families facing adversity. Intergenerational ACEs screenings at Merit launched on March 1st, 2025. Once screenings are complete, medical staff reviews the results and determine whether the score falls in the low or high risk category. Families with high scores are provided additional education, resources, and follow-up support from our social worker. In program year 4, we completed 49 universal ACEs screenings. Over half of those, more than 55%, resulted in a score of 4 or higher, placing them in the high-risk range. Most adult caregivers reported having little or no prior knowledge about ACEs or the long-term health risks of toxic stress. We developed an ACEs education and resource folder that is given to every family with a high-risk score. For children in Winnebago County, our social worker follows up directly with families to provide additional support and address any unmet needs. Beyond direct services, Merit is deeply committed to prevention, education, and community connections. This year, we expanded our outreach through trainings, community events, and public awareness efforts focused on protecting children. We're excited to partner with Darkness to Light and have an in-house facilitator for the Stewards of Children training. It's an evidence-based program that teaches adults how to prevent, recognize, and respond to child sexual abuse, and we offer it free to any adult in Winnebago County. So far, 59 adults have completed the training, and will continue offering sessions that can be tailored to groups and organizations. April is National Child Abuse Prevention Month. This year, Merritt kicked off the month with a countywide billboard campaign. As our executive director, Shannon Kruger, said, every child deserves a safe and loving environment to grow, thrive, and dream. I hope the billboards we created inspire Winnebago County to work together to protect their future and break the cycle of abuse in our community. Each year, we hold a pinwheel ceremony on the UIC Rockford campus. This year, 403 pinwheels were planted in the lawn, one for every child served through the Merit program. It's a moving reminder of the magnitude of this issue in our community and of the work still ahead to protect children. We hosted our first annual Protecting Innocence Symposium. We were honored to welcome internationally recognized author, speaker, and child abuse advocate, Erin Marin. We also heard from Dana Miller, a national trainer with the National Criminal Justice Training Center, and Jennifer Caciapaglia, a local leader who serves as executive director of the Mayor's Office of Domestic and Community Violence Prevention. Together, they provided powerful education and awareness on child abuse and neglect, making this symposium an incredible opportunity for free learning and professional development in our community. The symposium was comprised of 77 attendees from diverse professional backgrounds and community members. Participants called it eye-opening, inspiring, and an excellent event. The response confirmed there is both need and passion in our community for continued learning. We are excited to have registration open for our second Protecting Innocence Symposium on Friday, October 24th, 2025. This year, we were honored to participate in community resource fairs, community engagement, and opportunities to educate others. One of our favorite events was the Rockford Police Department's Trunk or Treat, where we connected with more than 1,500 children and families and were proud to bring home an award for Best Trunk. We have also increased our engagement on local and state committees, including participating on the City of Rockford's Educators Team and a recent appointment to the Illinois DCFS statewide Citizens Committee on Abuse and Neglect. This engagement ensures that the voices of children and families in Winnebago County are represented in shaping broader policies and practices. We have been honored this year to work with the strong network of partners you see here. Together, we're building a community of support for children and families. We look forward to continuing these partnerships and creating new ones. We'd love for you to stay connected with Merit and the University of Illinois College of Medicine, Rockford. Registration is now open for our symposium on October 24th, and you can find more information by scanning the QR code on this slide. You can also keep up with all of our events, including our future Stewards of Children trainings, by following the Merit Facebook page or checking the UIC Rockford events calendar. A heartfelt thank you for taking the time to learn about our program and for the support that makes these crucial services possible. Together, we are changing lives and building a stronger future for children and families in Winnebago County. We're excited for Program Year 5 and the opportunity to keep growing and evolving this work.